Anna. I'm sorry. Sorry. It's yelling at my daughter, Anna. Sorry, Anna.
Our daughter. It's our daughter.
Yeah, no, I was about to say, Anna, sorry. Forgot I was on mute. And there she is. There's Anna.
Hi, Anna.
Hello, everyone, and welcome to our community town hall, Healthy Lungs, Healthy Living. I'm your moderator, Catherine Ling, and we have the great fortune of being joined by our panelists, Dr. Anna Rule and Dr. Panagis Galiatsaitos. Dr. Rule is an assistant professor in the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. She is the director of Exposure Assessment Labs and the director of Pilot Projects Research Program of the Hopkins Education and Research Center for Occupational Safety and Health. And she has been involved in exposure science research for over 15 years with an emphasis on environmental and occupational exposures to aerosols, including industrial pollution and biological aerosols. We're also joined by Panagis Galiatsaitos, who is an associate professor and physician in the Johns Hopkins School of Medicine in the Division of Pulmonary and Critical Care Medicine. Both of these folks are incredibly committed to healthy communities and healthy breathing. And I'm very grateful for their time with us this evening. We have an opportunity for you to ask them questions. So please make sure that you type your questions in the chat on Facebook or on YouTube. I'm going to start off asking them a few questions to get us started, but please don't forget to put your questions in there so we can make sure that we're addressing your concerns. Dr. Galiatsaitos, let's start with you. Can you discuss the tobacco treatment clinic that you direct and what motivates you in your work?
Yeah, so thank you so much, Dr. Ling, and what an honor to be here amongst you all. As I'm a lung doctor over at Hopkins and massively biased with regards to how I see the lungs as, one of our greatest organs, and it's all of our organs' favorite organ, right? Because it can't function without the oxygen that is brought in by the lung with each breath. And the reason why I mention that is growing up here in Baltimore, born and raised over in Highlandtown and amongst an immigrant-heavy community, I got to go with my mom and dad oftentimes to these union hall meetings. And I was a kid. I was there. I was translating English to Greek for my parents. And what struck me there, though, was everyone smoked. People had cigarettes, passed them out. I was offered one as well when I was a kid. Didn't smoke. But as I got older and I had the good fortunes of coming back to Hopkins and working at the hospital where that served my community, those same union men and women were my patients on the pulmonary floor and in the intensive care units. So I started the tobacco treatment clinic out of a kind of a personal vendetta against cigarettes. It's robbed too many Baltimoreans of their livelihoods and of their lives. It is by far the #1 cause of preventative death in our city and in our state, more than opioids and guns combined. And I recognize it doesn't get the same attention right now in 2023 as opioids or gun violence, since these are immediate deaths. But as I work with our HEAT Corps team and others, when we go out into the communities to talk to kids about the safety of tobacco in adults, I make it clear cigarettes may not harm that 18-year-old version of you, but it will harm that 58-year-old version. So I started the tobacco treatment clinic dedicated to a population of individuals that also feel probably judged and stigmatized. They did it to themselves. They're the ones who smoke, and no one's helping them. I mean, yeah, I say this personally, because even physicians, we tell them to quit, and there's not a single other disease we've ever told a patient, quit having it. No one says quit having diabetes or high blood pressure. So in our clinic, started out of this personal journey to save as many Baltimoreans as possible, those who helped build this city, and give them the sophisticated science that is appropriate to help them through a very difficult addiction so they get the promise of health. And that's what I bring, especially for this evening tonight. So if you know someone who smokes, et cetera, you're welcome to ask those questions, but I'll finish with this. Always be pro-smoker to anti-smoking. Back to you, Dr. Ling.
Thank you so much. Dr. Rule, can you talk a bit about your research on environmental and occupational hazards, specifically assessing exposure to airborne pollutants? Oops.
Okay, I was muted. So thank you so much. And as Dr. Galiestato said, thank you very much for being part of this conversation, because it's such an important forum for disseminating information. So I don't study the lungs in particular, but I study what comes into the lungs. And when we have like a water advisory in the city, they can advise you to go change the water, drink from the filters, go buy water. But when there's an air pollution event, you cannot not breathe. You have to breathe. That's not an option. And so I think it's one of the most important sources of exposure that we have. And throughout the years, I have studied aerosols and exposures to aerosols in different settings. And so in occupational settings, for example, at the hospital, there's the patients that are there, but that's an occupational hazard for the physicians. When you come in with the flu and you're coughing, all of those are potential viruses, bacteria that may be breathed in by one of the occupational nurses or physicians or somebody that works at the hospital. So that's where the part of the occupational. And in the most recent years, I have been actually studying exposure to electronic cigarette aerosols. And I know they have been promoted as harm reduction. If you were a smoker, maybe if you transition to electronic cigarettes, maybe it's a reduction of harm, of risk. But we don't know, because really we don't really know what is in those aerosols. That vape plume that you inhale, or that somebody next to you is inhaling or exhaling, we really haven't been able to fully know what is in there. And so out of an abundance of caution, from what we know, it's definitely not air. And you don't want to put in your lungs something that is unknown. So I would say, like Dr. Galiestato said, I'm pro vapor, just against vaping.
These are really great points. And it's keeping care of the person at the center, but really looking for ways to stay healthy. So along those lines, how do you know if your lungs are in fact healthy?
I love this question. So your lungs are used how you want to use them. I know that sounds odd, right? But if I asked, for instance, Anurul, I'm Dr. Anurul, I'm going to pick on you, but lovingly, right? So if I ask Anurul, go run a marathon, and she's never run a marathon before, she's going to get short of breath at some point. It's not that her lungs are unhealthy. They're just not trained for that level of endurance. So lung health is rather personal, right? Are your lungs at the level you want them to function for what you want them to function for? Now, while I say that out loud, when does lung health transition to lung disease? And so from that standpoint, it really necessitates you listening to your body, right? So if Dr. Anurul was a frequent marathon runner, constantly doing them 3 times a week, then, one of the times when she realizes, like, oh my gosh, by the 3rd mile, I'm getting this isn't like me. I'm getting really short of breath. Or even yourselves, like, hey, I always take the 3 flights of stairs at work, or I walk from the parking lot to my building. If you start noticing very subtle things, very changes of breathlessness kick in, those are the times you report to your doctor, hey, is something happening to my lungs that I should be concerned about? Or things like a cough or sputum, excess sputum, phlegm that's coming out. I always say this about the lungs because those are the ways they will showcase some subtle symptoms before it turns into something potentially worse from a disease standpoint. So from a lung health, what it means is actually individualized for yourself, right? How you want to use your lungs, and if you can achieve that through conditioning, et cetera, perfect. But keep in mind the symptoms you should be aware of if your health is being robbed. Breathlessness, especially with activity, coughing that, it's going on for days to weeks, and especially if things are coming up, you're bringing up, I know it's dinner time, so I'm trying not to be too graphic, Dr. Lang. I'm trying to reserve that. But those are the 3 symptoms I would say. One last thing. Your lungs, through evolution, through the growth and development, really are designed that if something noxious comes in, right? Dr. Rule discusses how she studies these chemicals out there that, you inhale. If your lungs don't like them, one of their defense mechanisms is a cough. Your lungs, your airways are abundant with cough receptors. The reason why I bring this up is I get so many patients that discuss, I have chest pain. Could it be my lungs? Your lungs have almost zero pain receptors in them. Doesn't do you any good, right? Pain's meant to draw your attention to something. Well, something's in your airway. It's not like you can look inside. So all those cough receptors are there to kind of cough it out. So 3 symptoms I always say to just be mindful of to see if there's something happening to your lung health is breathlessness, especially with activities that you've done before. Now you're losing the ability to do them. A cough that's been going on for days and it's not explained by something like allergies or infection, and especially if there's excess production of sputum and phlegm. So Dr. Ling, over to you, my friend.
Oh, great analogy and great discussion that we should trust our bodies, that we know what our current state of health is. And if we're worried, we should share that worry is what I hear from you. And that's really important to know. Which brings up Dr. Rule. How do temperature and air quality begin to affect lung capacity?
Well, temperature is again, it's a little bit subjective, and it depends what you're used to. If I live in Arizona all my life and I'm used to this 100 and something degree weather, then that's different than if I live in, I don't know, in Canada, and I'm used to like lower. So again, your lungs, your body is amazing that it kind of like adapts to whatever the conditions you have. But the chemicals that you inhale, it depends again also on your condition, on your baseline condition. So if you're young and healthy, you probably can breathe in, like regularly some amount of chemicals that may be toxic and not feel anything. But like Dr. Galistato was saying at the beginning, your 20, 25, 30-year-old may not be feeling the effects, but your 50-year-old is going to start feeling those accumulative effects of things that you have been breathing. So air pollution, sometimes we have been doing a pretty good job in the United States of cleaning the air. So we think that we're breathing clean air, but there's some contamination in the air. And the good thing is it's definitely going down over the years, but there's some contamination. And so we have found that there's almost no safe level. At every level, it starts affecting you over time. And so over time, it might affect your lungs. And if you, for example, happen to have asthma, then you're more susceptible to those particulate matter or chemicals that come in the air than if you are a marathon runner and maybe your lungs are healthier. So again, it's not like a one size fits all, but it depends on your baseline and what your body can tolerate.
No, that's a great point. I want to just take a minute to remind those folks who are watching right now, please type your questions into the chat on Facebook or on YouTube, and we'll make sure that we put them here before the panelists. Anna, you brought up a really good point, and I'm thinking of the forest fires that happened in Canada over this summer. I won't call them elderly, I will call them vintage parents, moved to the Baltimore area this summer and loved having their windows open. And then when I was talking to them, they were short of breath and coughing and things. And it was during that time, and I had to tell them, what was going on because it didn't look hazy to them. So my question is, what are some good guides other than having a nagging child call and come after you? What are some good guides to keep an eye on air quality so we can maximize what we can do?
Well, that's a really, really good and really complicated question because like you mentioned, yes. Right? Like when I first moved to the United States from Mexico City, oh my God, Baltimore is clean compared to Mexico City air. It's a completely different level of pollution. what we were seeing here over the forest fires is sometimes the normal level that you see in some countries around the world. So it definitely is very subjective, but short of having a monitor in front of my house to tell me what the pollution is, there's many resources. The Baltimore City, the Maryland Department of the Environment puts out some advisories, so you can get some notifications. Today is a bad air day, so stay in, close your windows. If you have an air purifier, put on the air purifier, like we were doing, with COVID. That helps for any kind of particulate. So if you're elderly or younger, you're probably more susceptible. So try to stay indoors in a place that is relatively clean air. But other than that, there's really not a lot that you can do, unfortunately. So you have to kind of like pay attention and listen to your nagging daughter or your doctor.
I will make sure that I pull that out and share that with my parents as well. But no, thank you. It's one of those, how do we keep an eye on those pieces? And you brought up COVID. We're heading into indoor season with a change of temperature. Folks are going to be seeing an uptick in all sorts of respiratory diseases. Dr. Galeacetas, what impact does COVID and particularly long COVID have on the lungs?
Yeah, so, first things first, every respiratory virus that can make its way into the lungs has a potential for obviously immediate effects to even some lingering ones afterwards. So if something's able to be breathed in and gets into the lungs, then it's kind of a free for all is it more dominating the lung airways, causing things like bronchitis, or is it able to get into the lung tissue, what's called parenchyma, where then it can cause things like pneumonia. And actually with COVID, we all saw this, right? In the beginning, early parts of COVID, how many of us were like, oh my gosh, you can have kind of asymptomatic low oxygen levels, right? So everyone was getting a pulse oximeter. It was a cool thing to do, right? And I'm saying this because the earlier variants of COVID were much more lung tissue infiltrating, causing COVID pneumonias. And then our later variances were more airway involving, causing more bronchitis like picture. So those are the symptoms, those are the diseases you get initially. And the symptoms can range from breathlessness to fevers to bad cough or phlegm production and so forth. Now the question, though, after that, is you go through that, you survive it. Ideally, hopefully you've been vaccinated. And I'll make one plug about vaccines real quick here. Our immune systems, think about it, are the most remarkable thing that we have inside of us, right? Every breath we take, Dr. Rule and I, our immune system has to figure out with its, since it's in our lungs, since it's in constant contact with the outside world, friend or foe, constantly, right? And if it has to fight a foe, you want that immune system to be smart, not just strong. And the analogy I always give is think of a football team, right? Your Baltimore Ravens, they are at the gym every day. If they show up Sunday not knowing who they're going to play, they're probably going to lose. But if they went to the gym and they got the playbook, they'll know what plays to run. That's what vaccines provide us. It provides us that memory to fight an infection without causing harm. So I say this in the context of what Dr. Ling asked about, what can happen, especially after COVID. Well, we know if people have had immunity, ideally through a vaccine, so you don't have to suffer through the infection, you're less likely to have post-viral complications from COVID. However, if you do have them, it can be a variety of things. It can, COVID can cause a scar to the lung, and you may have residual symptoms from that, such as breathlessness and coughing. It can actually cause a lingering cough, right? As a lung doctor, I would say probably a top 5 reason patients see me is I got sick, I had COVID, and I'm still coughing 6 months later. Yeah, it's your lungs actually actively still healing, and they haven't found the right ratio of cough cells to ciliated cells, these other types of cells. So it still lingers, and it does eventually go away, but it lingers. In addition to that, you can develop something called long COVID that we think is more of a neurological disorder brought on by COVID, kind of how polio, which is more of a GI bug, then can cause this neurodegenerative disease that most people were familiar with. So with that in mind, you're right, Dr. Ling. I mean, we're embarking in our viral season, right? I know it's holiday season, but for us lung doctors, we call it the viral season. So if you haven't gotten a Hallmark card from us yet, so I apologize. But do what you can to stay healthy through this, and not just healthy and strong, but also smart, right? Because these vaccines for flu, for COVID, and if you're eligible for RSV, strongly support. They won't prevent infection. I tell every patient, these are like wearing a bike helmet. Bike helmets don't prevent falls. They just keep the falls from being too severe, right? So if you take the vaccines, if you catch it, it'll keep it from being severe because you got a smart immune system to fight it off. Back to you, Dr. Ling.
Oh, no, great. Thank you. Could you tell us what RSV is
Yes.
and who is eligible for that vaccine?
Yes. Well, and I'll answer it by going through the other two. So for the COVID vaccine, right now where we're at is with an updated vaccine, not a booster. Booster means I take the same vaccine and I'm asking you to take it again, right? An updated vaccine is like the flu. Every year we change it a little bit, not so much the technology of how it's delivered, but the variant we are targeting. So the COVID vaccine has been updated. Everyone is eligible, and I would say right now is an ideal time to get it. Flu, updated, and I know many of us became hip with vaccine terminology, and we went from a monovalent to a bivalent, and now we're back to a monovalent. Your flu vaccines are actually quadrivalent, right? So 4 different versions in them, or 4 different variants that they target, because we make this decision in the spring and we don't know what's going to come out, and then we give 4 to see if we can tackle the right one. But our Southern Hemisphere friends have shown us the vaccine actually was rather efficacious to prevent severe flu. And I would say right now is the right time to get the flu vaccine, not the virus, sorry, the flu vaccine. The flu rates are at the lowest at the moment, and they usually tend to pick up a little bit later around November, December. And going with the bike analogy, the bike helmet, it's better to put on the bike helmet before going on the bike than trying to put it on while you're on the bike. So get the flu vaccine at the moment as well. So now RSV, respiratory syncytial virus. And not to sound ageist, but it gets so much attention for our youngest vulnerable kids out there, right? Or toddlers or infants. And appropriately, it's appropriate to be mindful of them. But it also really plagues our older patients. They can be young at heart, but what their driver's license age says, right? If they're 60 and older, we need to be mindful of that. So the RSV vaccine right now is available for those 60 and older. And as I tell every patient, if you're 80 and older, go and get it. Go and get it. Grab a lollipop too while you're there, but go and get it. 60 and older, 60 to 79, I would encourage it, but unless you have underlying lung issues, then I would really strongly support it. Then it's also available for those who are pregnant between 33 and 36 weeks. So talk with your obstetrician to see if it's appropriate for you. Because if you do get it, then the mother can pass on those antibodies to the child and allow it to be protected during its most vulnerable times as an infant. So when can you get the RSV vaccine? I would say you can get it also now. You don't have to get them all at once. Biologically, you can. You're welcome to space them out weeks apart, 1 week for each one, and that way you can be less miserable all at once. But right now is the best time to get them, so we're best prepared for this upcoming viral season. Not the most exciting season, I get it. Let's be prepared. Back to you, Dr. Lane.
Absolutely. No, thank you very much. Dr. Rule, here's a question that we received. With all of the air quality issues that we've been having, I mentioned the forest fires that were a prevailing issue this summer. Is wearing a mask going to be a standard practice again?
Well, I am pro-mask. So as soon as the fire started, being announced before they even got here, because they started, way back in Toronto, I started wearing the mask because there's no downside to it. They're a little uncomfortable, especially in the summer. I agree, because when it's hot and humid, it's a little more uncomfortable to wear a mask. But the mask is going to protect you. The mask, as we have learned over COVID, there were some advantages. We all became very familiar with what a mask is, what it should do, and when is the mask more effective than others. And so if it's a mask that is very well fit, that it's actually a little harder to breathe, that means it's working. So that's the best mask to use. So if you don't mind wearing a mask and you're going to be out with the forest fire haze and this really bad air pollution day, wear a mask. If you're not going to wear a mask, stay inside and, stay with your windows closed and with the air cleaner. But if right now that is the virus season coming up again, I'm starting to wear a mask, even though I got my vaccines. I got my vaccines already, but I'm starting to wear a mask because we're all at risk and I may be infected and I don't want to infect other people. I'm also being very respectful of, I might be potentially infecting other people. So I don't mind. I am pro-mask. So as an occupational part of my occupational, I guess, formation, we do learn about masks and how good they are and how effective they are, especially in hospitals and other environments. So if we go back to masking, we go back to mask. I don't think we should make a big deal. We just do it and be safe.
Just think of it as a scarf that just goes up a little higher. I'm sorry, go ahead.
No, if I can just add to Dr. Rule, I mean, I'm with you 100%. I mean, masks were in favor for pulmonary patients before COVID, right? Many of our kids with cystic fibrosis, they wore them in order to protect themselves and others. We know it helps and we know it keeps people healthy. And what I would just suggest, as Dr. Rule, you beautifully said, we should think of this like a tool. Like, honestly, I tell people, think of it like an umbrella. The weatherman says it's going to rain. You don't want to get wet. We're sitting here telling you we got a viral season coming on. So if you're hearing EDs are packed, you're hearing sniffles and coughing, guess what? You don't have to be sick or ill. So just that's how I help out. So people, however it got politicized is unfortunate because there's such a great tool to help, especially people that need it, right? Those caregivers out there caring for one another. As you said, Dr. Rule, you don't want to get sick, and I don't want to make someone else sick. So that's it. Just very, very well said, my friend. Just from a lung doctor, I wanted to point out our pulmonary patients made these things cool before they were even cool.
And you don't need the lipstick. I mean, it really does. It really does take care of that. So with this prevalence of will the prevalence of chronic conditions like asthma, like COPD, are we going to be seeing an increase of these as we see an increase in the pollutants? Are they directly correlated going forward? Is this something we're going to be seeing more of?
Well, like I said a little bit at the beginning, we have been making a lot of progress. Like the EPA over the last 30 years has been cranking down on shutting down some power plants, on putting controls in the industry so that the whatever they are emitting into the cities is less polluting. So if you see the trends, they have been going down for all of the pollutants, for particulate matter, for the gases, for every single one of the pollutants that the EPA pays attention to and monitors have been going down over the years. Now the forest fire, that's kind of like unfortunate. The EPA cannot do anything about those, but fortunately there's shorter spikes, and then it dilutes and it goes away. So I don't expect that we're gonna have spikes in these diseases because the overall background air pollution has been getting better. But that doesn't mean that there's no susceptible people that may be very, very susceptible to those spikes, those short, high concentration episodes. So I don't know what the expert in lung thinks about that, but that's from my environmental health point of view.
Oh, I agree with you, Dr. Wu. We know, diseases come on from both a genetic standpoint and environmental, and then a combination of the two. If we don't take it seriously, what we can control in regards to the pollutants, if anything, our most vulnerable populations tend to get impacted the most. If anyone lives in Baltimore and you have a second to drive out to historic Turner Station in Dundalk, it's one of the most beautiful communities you can meet. They're also like a jump over a wall next to the Beltway. And so the amount of car emissions there, especially in the mornings during heavy traffic, you can see that smog rolling into the town. So we need to do what we can to protect our lungs and our the breath that we breathe in, because Dr. Rule is correct here. It's going to influence, for many people, their own active diseases, right? The number one cause of COPD from a COPD exacerbations, flares, from a non-infectious standpoint is air pollution. And we don't have to live like that. So, Dr. Rule is correct. We're doing our best to try to put crackdowns on legislation to help us out with factory emissions and so forth. There's some great movements here in the state of Maryland and Baltimore City to even update homes that use a lot more of gas and fossil fuel burning energy in order to renovate it and update it. So we'll do what we can. But for those of you interested, email us, contact HEAT Corps so we can give you insight in what you can do yourselves for promoting healthy air. We all deserve it, and we need to do what we can to prevent such a risk factor.
That's a great point that you both made, that we need to come at this not only from a personal perspective, what can I do as an individual, but also a policy perspective. What can we as communities bond together to do to make sure that we have an optimal place to become vintage ourselves and to raise our families in. But along those lines, we mentioned some factors you can control yourself around smoking. Embrace the smoker, but not the smoking habit. Same thing with the vaping. Embrace the vapor, but not the vaping. Does vaping have the same impact on lungs as smoking cigarettes?
I don't know that we know. I don't know that we know yet. The vaping epidemic is very new. And especially in the last couple of years, the last, I guess, push for the vaping have targeted younger vapors, younger population. And so this makes Dr. Pagliastatos and other pulmonologists' lives more complicated because we have seen some effects of some of the kids that are the most susceptible, but because these are long-term effects, like you can maybe vape for 20-25 years and we will start seeing the effects, and unfortunately it hasn't been that long since they're around, so we don't know. We would like to prevent this from happening, and we don't want to see these people 20 years from now maybe getting into the hospital. So part of the problem is we don't know yet, but we suspect that they're not great because of what we know is in that aerosol. It's not good. There are a lot of chemicals that are not good for you.
And just to follow up with that, Dr. was spot on. I mean, I may have said this earlier, but think about traditional cigarettes, right? The average age most people got addicted is in their teenage years here in America. And traditional cigarettes never harmed an 18-year-old, never harmed a 20-year-old, never harmed a 30-year-old, right? Their accumulative effect resulted in these individuals becoming patients in their late 50s and 60s with irreversible disease like emphysema, COPD, and cancer. So Dr. Roll's right. Our young kids being addicted to them, there's a strong plausibility that they will become patients later on. There's chemicals in there that really don't deserve to be in the lungs. And accumulating them over years and years and years, it's likely going to end up in them developing diseases. A few colleagues and I from Harvard put out some brief papers that showcases some level of impact already in youth who use it with refractory asthma or bronchitis. And these are reasonable surrogates to say, yeah, something long-term may happen that would be bad. So, the conversation about vaping or using cigarettes for adults, I think that's a different conversation left for the adult world. And I think it just depends what people want to get out of it. Like me as a lung doctor, if you want to get lung transplanted, you can't do either, right? So we use alternative standard FDA approved methods to help. But I think we just need to be mindful that these young developing lungs, developing into their early 20s, you don't want to rob that of any potential of reaching its most equitable outcome, be it occupational exposures or air pollutants, like Dr. Rule studies, or even vaping or traditional cigarettes. We want to make sure our kids get into adulthood with the best lungs and hopefully the wisest insights so they can make the best decisions for themselves.
Oh, great points. We have another question here. What is an aerosol? It was mentioned, and I just want to make sure I understand. That is a fantastic question.
Yeah, that is a very good question. Aerosol is actually any material that is suspended in air. And so it has to be suspended for a relatively long period of time. Like a ball is not an aerosol because it just, goes up and down. So that's not an aerosol. But if it's a plume or for example, a sneeze is a very good example of an aerosol. It's like some air that comes out with some saliva, and there might be a little, I don't know, some viruses and some of that. But aerosol is also, when you look out the window, what is emitted from the factories, what is any kind of material that is suspended in air. And so like vapor is an aerosol, and smoke is an aerosol. So as long as it's suspended in air for some time, it is considered an aerosol, which I don't know if you all remember, but that was an early debate with COVID. Is it in aerosol? Is it suspended in the air or not? And so we have known for many, many, many years that whatever comes out of our mouths is potentially an aerosol. Some of the particles fall down, but some stay suspended in the air. So that's a very general, but it's a kind of like a sciencey term. But hopefully that's clear.
I really like that ball analogy because that makes a lot of sense. Here's another great question. And by the way, if you're watching this live streaming on YouTube or Facebook, feel free to type in a question in the chat. We're getting some wonderful questions here. Dr. Rule mentioned how vaping is seen as harm reduction. Can they both elaborate on why vaping has been framed that way?
So I think it's been framed that way for the intention of harm reduction around potential cancer. Everything that I've seen, especially across the pond or over there in the United Kingdom, they recognize the strong cigarette cancer link, right, that we've reaffirmed decades ago. And for individuals really struggling with nicotine addiction, traditional methods that are FDA approved, such as nicotine replacement therapies or varenicline, those are hard for many patients to completely become a non-combustible cigarette user. And so the introduction of electronic cigarettes were seen to hopefully reduce, while patients try to come off their nicotine addiction, their potential chances of developing lung cancer. And keep in mind, though, that is meant to be a transient tool. And I always leave it open that for the right patient, I think that is a reasonable approach. However, at the same time, we need to be mindful that it might not be for the right patient for other things, right? If you have really bad asthma, you need no chemicals, right? If you have really bad chronic obstructive pulmonary disease, same concept. So harm reduction, I think the conversations tend to happen around its ability to reduce the likelihood of cancer for someone truly trying to come off of cigarettes, be it electronic or combustible. And I think in that context, I think there's a reasonable conversations to have, as long as people realize it's meant to be stopped. It's not meant to be a permanent new lifestyle take on. So I think that's where the introductions happen. But I really want to make the point and drive home, you have to talk to your doctor where they can weigh in as well. If you're someone with no lung disease, no even heart disease, right? Because the inflammation from vaping can even impact the heart. They may guide you and say, okay, look, just keep me updated, but you got to come off, right? This isn't permanent. So I've always maintained that level of openness. But otherwise, you just need to know your health in order to make the best decisions for yourself. Dr. Rule, over to you, my friend, and as you studied this extensively.
The only thing I want to add is when it started being promoted as harm reduction, my argument is it may, which we don't know for sure, that it may, like Dr. Galestato says, it may be reducing the harm of the cigarette smoker, because we know there's few things as bad for you as a cigarette. But for somebody that has never smoked, it's not a risk reduction, it's a risk increase, because compared to breathing clean air, putting anything in your lungs like vaping aerosol is not a risk reduction. So you always have to keep in mind when somebody's talking about risk reduction, they're talking about the smokers. They're not talking about the teenagers that started vaping when they were never going to be smokers. And unfortunately, some of them are now picking up cigarette smoke, which we never thought that was going to be, like a possibility. We really thought that because of the flavors and all of that, the younger generation was going to just kind of like stick with the vaping. But some of them are transitioning into smoking. There's some CDC data. That's really sad, because that's the worst thing that can happen, that go to really more risk. So.
No, that's a great point. And so, depending on your starting point, it's either harm reducing potentially, maybe, or harm increasing. Now, would this still be the case for, say, cannabis inhalation?
Yeah, so is the question, is cannabis inhalation a harm reduction to combustible cigarettes?
Or does the same rules that you're talking about with cigarettes and vaping, do they apply to cannabis inhalation?
Yeah, I'll answer it as a lung doctor first, and then Doctor will dive in as well. The 30,000-foot view as a doctor, our lungs want air. That's it. At the same time, I'm mindful that people are social beings, will make their social decisions that make sense for them. The analogy I always give is probably have gone to a bar and you don't see liver doctors and they're screaming, don't drink, right? We make the right decisions, and hopefully we do it with a version of the most moderate of ourselves, right? Not in excess, not to overdo it. While we may walk on the lines of health, we won't cross them into an unhealthy situation. And the reason why I'm saying it in this context, just like for people who smoke, I hold no judgment over them. Their decisions to do that, it's personal, right? If you talk to someone who smokes cigarettes, the anthropomorphization of a cigarette is, recognizing to me that they've used it for many reasons to compensate what they're going through. And I say the same thing about cannabis. Right? When people choose to do it, whether it's a social, et cetera, as long as they realize, look, what is my health? What can I tolerate? And do you have an ability to come off of it if you don't want to do it anymore? While it probably holds addictive properties on par with other chemicals, nothing will compare to the level of addiction of nicotine, in my opinion, just because nicotine is kind of introduced throughout the day and you do it for decades. You're not inebriated. You move on with your, it's only addictive substance at work you had breaks for, right? You had smoke breaks. No one ever had a beer break or a cannabis break. So cannabis, I don't see it as a harm reduction per se. It probably doesn't get the gravity of harm that traditional cigarettes get, probably because of the infrequency of its use, right? Cigarettes, you go through a pack a day. No one goes through a pack a day of cannabis. So at the end of the day, what I would say, again, no judgment, but whatever you should participate in that can hold an addictive potential, even if it's slight, just recognize where your boundaries are, where your health is, and come off of it, or talk to your doctors about how to come off of it. And at the same time, also talk to your doctors if you are using, because goodness forbid, if you do suffer a complication, we want to be present and ready to help you with that. Dr. Wu.
I don't have much to add. Other than it's still an aerosol, it's still not air that you're putting in your lungs. So. Perfect.
Thank you, my friend. We really got to take the show on the road whenever you're not marathon running. I don't know.
I will be there to hold the luggage for you both, because this is a really good interplay between, what we see with your body and what we're taking in from the air. And that's really what a lot of these questions that we're getting from our community are about. What are safe levels? How do I protect my health as well as protect the health of those that who I love? And Panagis, you've mentioned COPD, or chronic obstructive pulmonary disease, a couple of times. What is that, and how can we prevent it? Because for those who may not have heard of it before, it doesn't sound good, and it's not.
Yeah, no, it's not. And it's one of the top 3 leading causes of mortality globally. And also, the name doesn't sound good. Being lung doctors, we're not the most clever of naming things. So you're like, oh, this disease is chronic. Okay. It's obstructive. I'll explain what that means. And it happens to the lungs and is a disease, so pulmonary disease. So obstruction here implies air trying to leave the lungs is blocked or weakened greatly. And so why that's important, it means air gets trapped. And if air is trapped, new air can't get in. So patients are feeling breathless with a heavy chest. The chronicity is brought on by something that's resulted in the lungs to become irreversible, right? So maybe the number 1 cause has been cigarette smoking. Beyond that, air pollution, right, is massively up there. We've seen with certain pollutants, people develop COPD at high rates. And even right now, right, where the U.S.'s smoking consumption is falling to its all-time low of 14%, but COPD numbers continue to go up. The big explanation there has likely to do with Dr. Rule studies with the environment and air pollutants. So the best way to prevent, one, well, cigarettes cause it. So making sure we don't introduce that. And I would say the same thing with electronic cigarettes. Because anything that you do for decades is likely going to result in this. So when I say smoking or even combustible or electronic, you need decades of use of that, right? Every patient with COPD diagnosed in their 50s started smoking as a teenager. So that's what we want to be most mindful of, preventing that. So that's one way to prevent, right? No vaping or smoking. The other way is recognizing how much of an influence air pollution has on our bodies. So work with the Breathe Center, work with us. We're colleagues with Dr. Rule, where we can help each other with legislation around air pollution and so forth. And finally, the other part is what happens in childhood, right? Kids, the prematurity, frequent infections that set patients up for asthma, these things can lead to later on in adulthood, COPD. Those are my 3 biggest recommendations, right? Cigarettes, whether electronic or combustible, air pollutants, and childhood health overall, from in utero to your teenage years.
Fantastic. You mentioned environmental irritants being a potential cause of COPD. With vaping and combustible cigarettes, there is a secondhand smoke phenomenon, and even with cannabis. What impact does that secondhand exposure have on lung disease?
Well, we know a lot about secondhand smoke because it's been studied very well for many, many, many years. Unfortunately, we don't know as much about secondhand electronic cigarette aerosol or vaping because it's relatively new. So unfortunately, we can't tell yet, what the health effects might be. But we do know there's chemicals in the air when somebody exhales. There's chemicals on the surfaces after the electronic cigarette has been smoked or vaped. You can smell it on the person, right? It's that sweet kind of like, I don't know, like cotton candy smell. If it's there, it means there's chemicals on the clothing, and all of those is what we call secondhand or even thirdhand. I don't know if anybody's familiar about that, but there it's too soon to know what the health effects are because, like we've been saying, usually like a cumulative of many, 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 many years. But if you live with a vapor, probably you're getting exposed. Maybe less than the vapor, but you're still getting exposed. So we don't know yet. And it would be better if we, if you could ask the vapor in your life to please vape outside so that you are not exposed.
I'll add to Dr. Rule. She's spot on. A lot of the diseases are from a chronic exposure. In our clinic, we published the very first case of secondhand vaping causing an issue. And this is a very rare disease. It calls Dr. Rule calls hypersensitivity pneumonitis, which is like an allergic reaction in the lungs. It is rare, massively rare, but the emphasis of it demonstrates, as Dr. Rule's mentioned, when you whatever you breathe out, those are still chemicals. Those will still pose harm to people. And chronic exposure, as Dr. Rule said, likely holds the same potential of causing harm.
So we're winding up. I just want to pose one more question to you both. How do you advise folks who are struggling with cigarettes or vaping use and or addiction? Where can we go for help? And also, Dr. Rule, if you have some concerns about the environment, where can you go for help?
Well, I know, and this is a little more for a physician, but for the vaping and the smoking, there's a free quit line. There are many resources. Talk to your doctor, and they can recommend cessation strategies. Sometimes it's like not one thing that helps, but a combination of things. So doing maybe a nicotine patch or reduce your intake little by little. In the beginning of the electronic cigarettes, that seemed to be working when you could change the nicotine concentration in the cigarettes, so using them to reduce the use. But regarding environmental exposures, that's a little more complicated. So for that, you have to just be aware that this is a potential exposure, and especially during the summer and in the winter, in very very rare occasions when we have these fires, or if there's burning somewhere, just be aware that inhaling that smoke, you're inhaling chemicals into your lungs, and so that potentially can be accumulated.
I'm just going to echo what Dr. Rule said. Whatever you're putting into your body, just always make sure you share it with adults you trust, doctors ideally, just so we can be there to help you come off of it if you have an addiction, or at the same time be just prepared for any complications. Doctor, I tell this to every patient, and hopefully your doctors are the same way. We're not your mom, we're not your priest, imam, or rabbi. We hold no judgment. Just tell us so we can take what's the best care for you possible. And at the same time, you should also share with trusted adults who can be part of your support system if you should ever need help. So we're all here too. So you can always reach out to Dr. Ling or Dr. Rule, again, when she's not running her marathons. Dr. Rule, I don't even know if you run marathons. I was using that as an example. Do you? I was like, did I just pick something? All right, good.
I do not. So I've been getting a laugh. Because my husband does, but I don't. So I just go root for him.
Got
it. So I was going to say, but there's something to be said about using your lungs in cheering, as well as in running. So this has been an incredibly fruitful discussion. Thank you both so much for bringing your expertise here. I hope everyone takes the messages on with them, that lungs like air, but they like air that without anything added to it. And that really coming to experts and looking to where they can make sure that the air they're taking in, either at an individual level or at a community level, that's going to be some of the most important work we can do to stay healthy. For more information on HEAT Corps and other initiatives from the Office of Government, Community, and Economic Policy Partnerships, follow at JH Connects and at JHH HEAT Corps on all your social media platforms to stay updated. Special thank you to our featured guests, Panagi Skaliatsados and Anna Rule, and the HEAT Corps team for providing this content. These town halls would not be possible without the expertise of this team. And thank you to Johns Hopkins University and Medicine.
Thank you.